Ophidia. In considering the remedies derived from the animal kingdom, first I shall speak in extenso of the large family formerly called Ophidians or snakes proper. Of these we use in medicine, we have first the Lecasis trigonocephalus. This was proved by Dr. Herring 60 years ago. Next we come to Crotalus horridus. There is also a South American species proved by Dr. Muir, the Crotalus cascavella. This has a few symptoms which will not yield to the administration of other species. Then there are the Naza tripudians, one variety of the cobra, and the Elas corallius, so called from the shape of the scales on the back, which have something like the appearance of coral. Lastly, there is the Borthros lanceolatus, a remedy which for a year or more I have vainly tried to procure. It causes symptoms similar to that peculiar condition known as aphasia. Of these poisons, the first four are commonly used in medicine. The poison of the snake is generally held in a little sac behind the fangs. On the other surface of the fangs is a small groove into which empties a little tube that conveys the poison from the gland. When they are not in use, they lie back on the roof of the mouth. If the animal is excited, it opens its mouth, the fangs are pushed forward, and at the same time by muscular action a drop of the poison runs down the canal and into the punctured wound. Now what follows? That depends on various causes. The poison is more potent sometimes than at others. The more angry the serpent is, the more active is its venom. If in inflicting the wound, the fang passes through the clothing, some of the poison may thus be absorbed. Again, the power of resistance of the individual has some effect. Thus, you may divide the effects of the snake poison into three sorts. First, that which may be compared to the action of a stroke of lightning or a dose of prussic acid. Immediately after the bite, the patient starts up with a look of anguish on his face and then drops dead. This represents the full unmodified lightning rapidity of the poison. In the second form, commonly, the part bitten swells and turns not a bright red but rapidly to a dark purplish color. The blood becomes fluid and the patient exhibits symptoms like those characteristics of septicemia. The heartbeat increases in rapidity or lessens in tone and strength. The patient becomes prostrated and covered with a cold clammy sweat. Dark spots appear on the body where the blood settles into ecchymosis. The patient becomes depressed from weakness of the nervous system and then sinks into a typhoid state and dies. Or there follow nervous phenomena, vertigo, dark spots before the eyes, blindness, a peculiar tremor all over the body, face besotted, dyspnea, and even stutter. Or the process may assume a slower form. After the vertigo or trembling, the patient remains weak and the wound turns dark or gangrenous. All the discharges, the sweat, the urine and the feces become offensive. Dysenteric symptoms of a typhoid character should show themselves. The patient goes into a low state and finally dies. These are all perhaps of the action of these powerful poisons on the blood and the nerves. The Ophidia as a group are characterized by their paralyzing action upon the nerves. They directly weaken the brain and heart action. Then follow decomposition of the blood, changes in the muscular tissue and local death from gangrene. At first there is developed a condition of anxiety, mental excitability and oversensitiveness of the brain with hallucinations, anxious fear, etc. Afterwards arises nervous depression varying from such a debility as it observed in severe or protracted diseases and advancing old age to mental confusion, stupor, low delirium and paralysis. Constrictions are noticed as in the thorax, larynx and sphincters in general. Hemorrhages which are usually dark, decomposed, oozing from every orifice of the body, thus also ecchymosis. They are most marked under lechosis and crotalus, less in elas, least in nasa. Face sickly, pale, anxious, bloated, dark red or bluish. Special senses altered, dim vision, excitability of the brain and the spinal cord, accounting for the mental restlessness and bodily sensitiveness. Predominant, even with the pains, are torpidity, numbness, twitching, formication. You already see in what class of diseases you will find these poisons curative. Inflammations and fevers of low destructive type, such as gangrene, malignant ulcerations, diphtheria, typhoid, pyoemia, carbuncles, etc. With all there are tendency to faint, muscular prostration, trembling as in drunkards, irregularities in circulation, flashes of heat, apoplectic conditions and paralysis. Nerves especially affected by the snake poison seem to be the pneumogastric and spinal accessory. Consequently, you expect to find as eminently characteristic symptoms of the larynx, of the respiration and of the heart. All the ophidia cause choking, constrictive sensation coming from irritation of the pneumogastric. All of them have dyspnea and heart symptoms. Moreover, the ophidia produce a yellow staining of the skin. This is not jaundice and must not be confused with duck affection. It comes from the blood and is due to the decomposition of the fluid, just as we find in yellow fever, typhus or pyoemia, and not to be stained of the skin with bile. This is the most marked in crotalus. అందుకే crotalus లో చాలా yellowish అయిపోతుంది. బాడీ స్కిన్ రెడ్డిష్నెస్ yellowishness. అందుకే టాక్సిక్ కండిషన్ ఫీవర్స్ లో మొత్తం బాగా yellowish గా అయిపోయి రెడ్ స్పాట్స్, బ్లీడింగ్ స్పాట్స్ అవి ఉండి బాగా స్వెల్లింగ్స్, బాడీ అంతా కూడా పఫీనెస్ అవి ఉన్న కేసులో, బ్రౌజినెస్ అవి ఉన్న కేసులో crotalus ఇస్తే వస్తాయి. Again you may find that the skin is dry and harsh. అది యాక్చువల్గా crotalus పాము వచ్చిన వాళ్ళకైతే మేము చూసాం ముషి వాళ్ళు. వాడికి ఏంటి కళ్ళలోంచి బ్లడ్ వచ్చింది. వాడు crotalus లో ఎలా ఎక్స్ప్లెయిన్ చేస్తాడో, కళ్ళలోంచి బ్లడ్ వచ్చింది, ముక్కులోంచి బ్లడ్ వచ్చింది, నాలిక తాపమంటే నాలికలోంచి ఇలా బ్లడ్ కారుతాను, నాలిక చేస్తే ఈ స్కిన్ పోర్స్ లోంచి బ్లడ్ వచ్చింది. అక్కడికి అప్పుడు 3 రోజులు అంతా ఆయన పాము కడిచి వాళ్ళు ఏదేవో ట్రీట్మెంట్స్ చేయించారు, మంత్రాలు చేశారు, ఎక్కడ ఏం ఇదే. అప్పుడు ఎవరో చెబితే తీసుకొచ్చారు. వాడు వచ్చేసరికి ఏముంది, వాడు మొహం అంతా ఉబ్బిపోయింది, ఇలా అసలు వాడు సెమీ కాన్షియస్ గా ఉన్నాడు, మొత్తం ఇలా వాడు బ్లడ్ వచ్చేస్తుంది ఏటికి. crotalus లో ఏదైతే డిస్క్రైబ్ చేస్తాడో అది వాళ్ళు చూస్తాం అలా ఉన్న ఇది. వాడు crotalus 200 వేసి ఆ తర్వాత మళ్ళీ ఒక 4 hours 5 hours తర్వాత ఇంకో డోస్ వేసి, ఆ తర్వాత మళ్ళీ 12 hours కో మళ్ళీ 14 hours కో ఇంకో డోస్ వేసి, ఆ తర్వాత 24 hours తర్వాత 1 ml వేస్తే దాంతో సేవ్ అయ్యాడు. ఫస్ట్ డోస్ కే ఈ బ్లడ్ రావడం అయిపోయింది. ఆ తర్వాత 3-4 days వేస్తే నార్మల్ అయిపోయింది. అలా crotalus కేసులు 2 చూసాం. ఒకటేమో వాడు కుర్రాడు, వాడు 8 ఏళ్ళు 9 ఏళ్ళు ఉంటాయి. ఒక గేదెని తీసుకొచ్చారు, గేదె కలిసింది. ఆ గేదెకి ఇలా స్కిన్ నుంచి వచ్చేస్తుంది బ్లడ్, డ్రింకర్స్ ఇలా పాస్ చేస్తుంది, సొంగ కాకుండా బ్లడీ. అది బతికింది crotalus కేసు. 200 రిపీటెడ్ డోస్ చేయాలి, 3-4 డోసులు. వీడికి crotalus వేసి అక్కడ ముష్టిపడిన మన దగ్గర మళ్ళు ఉన్నాయి, మనిషి గారు ఇచ్చిన మళ్ళు పెడితే 2 మళ్ళు అతుక్కుపోయాయి, రావు. ఆ పాయిజన్ పూర్తిగా ఇచ్చేదాకా రావు ఆ మళ్ళు. అప్పుడు వాడికి ఒక మణేమో 36 hours తర్వాత ఊడిపోయింది, తెచ్చి ఇచ్చారు. ఇంకో మణి 72 hours తర్వాత ఊడింది. ఆ మణి పాలలో వేస్తే పాలంతా పచ్చగా ఆకుపచ్చగా అయిపోతాయి. అప్పుడు ఈ మణి మళ్ళీ ఇంకోళ్ళకి ఉపయోగిస్తాను వీలుంటుంది. మణి అతుక్కోలేదంటే వాడికి పాము కలవలేదని అర్థం. తీసుకొచ్చిన కేసులో చూసాం, పాము వచ్చిందండి అని చెప్పి తీసుకొస్తారు. విపరీతంగా క్లియర్ పాము ఏదో చూసుంటారు వీడికి దీంతో మనీ పెట్టి అంత ఎంత పెట్టినా అతుక్కోవట్లేదు. దర్శనానికి నేషనల్ వైద్య నిపుణులుగా చాలా ఉంటుంది, చాలా బాగా పనిచేస్తుంది. ఎక్కడైతే ఏ ప్లేస్ లో అయితే కలిసింది దానికి స్టార్ ఏమన్నా దాని చుట్టూ వేసి ఆ తేలు కలిసినటువంటి స్పాట్ ఆ స్టార్ మధ్యలోకి రావాలి. అలాగే స్టార్ ఏమన్నా 5 పాయింటెడ్ స్టార్ చాలా బ్రహ్మాండంగా పనిచేస్తుంది. గాంధీ గారి ముందు ఉంటుంది, అది తయారు చేస్తాం సార్, అది బాగా పనిచేస్తుంది. రెయిన్ వాటర్ పట్టమన్నాడు, రెయిన్ వాటర్ పట్టించి దాన్ని ఉప్పు సాచురేటెడ్ సొల్యూషన్ గా చేయమన్నాడు. ఇంకా కరగకుండా ఉండే స్థితి దాకా ఉప్పు దాంట్లో రోజు వేస్తుంటారు రెయిన్ వాటర్ లో. ఆ కరగకుండా ఉండే స్టేట్ వచ్చిన తర్వాత దాన్ని ఫిల్టర్ చేసి 1 year మూత పెట్టేసి ఉంచమన్నాడు. ఆ 1 year తర్వాత తీసి తేలు కుట్టినవాడు వస్తే ఈ కంట ఒక 2 drops, ఈ కంట 2 drops వెంటనే తగ్గిపోతున్నాడు. గాంధీ గారి పేరు ఉండదు. 2 కేసుల్లో కుటాలతో తగ్గలే. ఒక 2 కేసులు ఈ ఊళ్ళో ఒకటి, శ్రీశైలంలో ఒకటి ట్రీట్ చేశాం. వెరేట్రం విరిడే అని దాంతో తగ్గింది. సాయన్న వాళ్ళ అక్క ఉంది కదా భవాని, దానికైతే ఫస్ట్ వెరేట్రం విరిడే నేను వాడ్డాం. అమ్మాయికి ఫిట్ వచ్చి పడిపోయేది. ఆ ఫిట్ వచ్చి పడిపోయింది అంటే ఇక్కడ ఎవరో ఒక రాయితో కొట్టాడు అనేది ఇలా బ్లడ్ వచ్చేస్తుంది. ఇక్కడ ఎవరు కొడతారు, అస్తమానం ఎవరు కొడతాడు, రాయితో కొట్టాడు మీద బ్లడ్ వచ్చేది, ఇక్కడ ఫిట్ వచ్చి పడిపోయేది. ఏం చేస్తారు పుటాలొస్తుంది, ఏం చేస్తారు. వెరేట్రం ఆల్బమ్ లో ఇస్తారు, ఆ హిస్టరికల్ టెండెన్సీ ఇస్తారు. కానీ ఈ అమ్మాయికి ఆ వెరేట్రం ఆల్బమ్ తాలూకు హిస్టరికల్ సింటమ్స్ అన్ని లేవు. వెరేట్రం విరిడేలో బ్లీడింగ్ ఇచ్చాడు, అంటే వెరేట్రం విరిడే వేస్తాను. అది ఎప్పుడు 84లోనో 85లోనో ఫస్ట్ అమ్మాయికి. అంటే ఆ తర్వాత అంతకుముందు ఏవో చాలా వేసాను, కృతాలు సుఖాలు పరువు ఇవి చాలా వేసాను, గెల్డోనా అవన్నీ వేసాను. అది ఎంతో తగ్గదు, అమ్మాయికి అలాగే ఇస్తుంది. ఉండండి 10 రోజులకి 15 రోజులకి ఒకసారి వచ్చి పడిపోతుంది. సాయక్క వాళ్ళ అక్క దానికి సరే వెరేట్రం మీద ఎక్కువ తగ్గింది, చాలా రోజులు రాలే. అది మళ్ళా రిపీట్ అయితే మళ్ళా వేస్తాం. మొత్తం 3 డోసులు 4 డోసులు అయితే ఇంకా మరి ఫిక్స్ లేవు, బ్లీడింగ్ లేదు. ఎవరో రైతు ఇక్కడ కొట్టాడేది మొట్టమొదటిసారి వెళ్తే నమ్ముతాం, ప్రతిసారి అయితే ఎవరు కొడతారు ఇంట్లో ఉంటే. ఇంకో కేసు శ్రీశైలంలో మురళి గారు చుక్కాలకమ్మ ఉంది. ఆ అమ్మాయికి ఏంటి ఉన్నట్టుండే అలా బ్లడ్ పడిపోతుంది, ఏమవుతుంది అయ్యేది అలా వీక్ అయితే అలా కాన్కాన్స్ అయిపోతుంది. అదే ఇచ్చాము ముందు చాలా మెడిసిన్స్ ఇచ్చాను, చాలా ఎమోషనల్. ఏమి ఇచ్చినా అమ్మాయికి తగ్గదు. హైదరాబాద్ తీసుకెళ్లారు, అన్ని టెస్టులు చేయించారు. వాళ్ళు ఎందుకు వస్తున్నారు మాకు అర్థం కాదు, అన్ని టెస్టులు నార్మల్ గా ఉన్నాయి. ఏమి అమ్మాయి ఏదో ఏవో చెప్పారు, సైకాట్రిస్ట్ చూపించారు, చూపించారు, అది కానీ అప్పుడు హిస్టరికల్ టైం. మిగతా అప్పుడు ఎలా ఉంటుందంటే ఏం లేదు, శుభ్రంగా ఉంది, పోయి ఇంత చనిపోయింది, నీరసంగా ఉంటుందా, ఎనిమిక్ కండిషన్ ఏం లేదు, బ్లడ్ టెస్ట్ చేసి హెమోగ్లోబిన్ నార్మల్. ఇది చనిపోయిన తర్వాత కూడా సరే అప్పుడు అమ్మాయికి వెరేట్రం విరిడి 200, తర్వాత 1M కూడా వేసినట్టు 3-4 డోసులు అయ్యాక తర్వాత అమ్మాయి పెళ్ళి బాగా అమ్మాయికి వామిటింగ్ బ్లడ్ వామిటింగ్. అమ్మాయి మెంటల్ కండిషన్ చాలా హారబుల్ అసలు, మాస్టర్ స్టేజ్ ఆఫ్ మెంటల్ కండిషన్. పెళ్లి వెంటనే చేసుకోవాలని ఒక కోరిక, తొందరగా పెళ్లి అయితే బాగుందని. సరే సంబంధాలు చూస్తాను, నాకు పెళ్లి వద్దు, ఆ కాంప్లికేటెడ్. This is most marked in Crotalus. Again, you may find that the skin is dry and harsh, as if there was no vitality in it, or it may be clammy, more characteristic of lechosis. The discharges are fetid even the foreign fecal stools of lechosis are horribly offensive. As the heart is weakened by all, we find as characteristic running through them all, weak heart, cold feet and trembling, not the trembling of mere nervousness, but the trembling of weakness from blood poison. దానికి దీనికి తేడా ఇచ్చాడు కదా, దాన్ని నర్వస్ ట్రెంబ్లింగ్ మామూలుగా ఉంటుంది. ఈ బ్లడ్ పాయిజనింగ్ వచ్చేదానికి ఒళ్ళంతా కూడా తలవిడిపోతుంది నర్వ్స్తో పాటు. The cold feet are not indicative of congestion as you find under Belladonna. They are attendant upon a weakened heart. The heart symptoms of NASA resemble greatly those of lechosis, but its cardiac symptoms point more markedly to the remote effects of cardiac valvular lesion. Those of lechosis are more to the incipiency of rheumatic disease of the heart. In NASA, there is a well-marked frontal and temporal headaches with the cardiac symptoms. The heart beats tumultuously. The patient abates, gasping for breath. NASA causes more nervous phenomena than any of the snake poison. Under Belladonna, the head is hot and the feet are cold because the blood surges through the head. Under the snake poisons, the feet are cold because the heart is too weak to force the blood to the periphery. All of the snake poisons cause inflammation of the cellular tissue. Accordingly, we find them valuable with when cellulitis arises in the course of typhoid fever, diphtheria, etc. The color of the affected part is dark red, purple or black like gangrene. Cellulitis. In diphtheria, Crotalus has had more clinical confirmation in the persistent epistaxis. Elapsed gains attention in cases of hemoptysis when the blood discharged is dark in color, especially when the right lung is affected. Antidotes for these poisons are numerous. There is no doubt that alcohol is a powerful and antagonistic to the snake venom. It is remarkable how much alcohol can be swallowed by persons bitten by serpents without the manifestation of usual physiological effects. Dr. Herring recommends radiating the heat as an antidote. Radiating heat. నిప్పు దగ్గర బాగా వేడి చెగ కొట్టేలాగా పెట్టమన్నాడు, పెడితే యాంటిడోట్ చేస్తుంటారు. The part bitten should be held close to a hot fire. Ammonia or permanganate of potash have been recommended as antidotes, and cures have been made claimed for each. Lecture Ophidia. Now let us consider lechosis. First of all, in order that you may comprehend the subject, I wish to refer to those symptoms which are universal. We notice that lechosis is especially suitable to persons who have a peculiar sensitiveness of the surfaces of the body. Even if the patient is lying in a stupor and you touch him, as when you try to feel his pulse, he will show that he is disturbed thereby. Hard rubbing or pressure may cause no trouble at all. Dr. Herring, who first proved lechosis, would never tolerate tight clothing about his neck. He always wore his collars loose. He noticed that during the proving this symptom annoyed him more than usual, so he faithfully made note of the occurrence but did not place much value on it. Since then, the symptom has been confirmed many times in practice and has been found true not only as a local symptom of the neck but as a symptom of the body universally. The explanation seems to be that there is an irritation of the peripheral nerves, and because of this the patient cannot bear touch or slight pressure. It is no evidence of inflammation and must not be confounded with the inflammatory soreness of aconite, arnica or belladonna. The sensitiveness also differs from that of epis, which has a bruised, sore feeling more acute than that of arnica. It also differs from the sensitiveness of naswamica and lycopodium, which have it about the waist only after a meal. Next we find that the drug is prone to affect the left side of the body. Homeopaths have been criticized for attributing to drugs the power of acting upon one side of the body in preference to the other. And the simple fact that diseases choose sides ought to be enough to lead one to believe the drugs may do the same. The drugs may do the same. The left side of the body is more apt to be affected by drugs having a depressing action because that of the body is weaker. Another peculiarity of lachesis arising probably from its action on the pneumogastric nerves is its influence on sleep. This is a universal symptom that the patient is worse from sleep. He sleeps into an aggravation. If it is true that lachesis has an influence on the centers of respiration and is a weakening drug, we can understand why sleep should aggravate. During our waking hours, we have some control over respiration. During sleep, this voluntary control is lost. It is when this change takes place that the weakening effect of lachesis is accepted. Lachesis is a very valuable remedy at the climax, especially in the woman who has exhausted herself by frequent pregnancies and hard work. In this worn-out condition, there occurs a sudden cessation of the milk. Suppression or non-appearance of discharges always makes the lachesis patient worse. Perhaps previous to the climax, she was worse before the flow than during it. The pulse is weak and tremulous. There are the peculiar headache and the annoying symptoms of the mind, heart flashes and nervous symptoms characteristic of the drug. Now let us consider some of the symptoms of lachesis in detail. First, as to the mental symptoms. The patient is nervous, anxious, loquacious, jumping from subject to subject, sometimes with the fear of being poisoned, which causes him to refuse the medicines you offer. Interesting stories excite immoderately and even intensify the bodily symptoms. Sometimes the anxiety assumes a peculiar type and he imagines that he is dead and the preparations are being made for the funeral. అలా గట్టిగా నమ్ముతుంటే వాడి కళ్ళు కూడా అలాగే వస్తాయి. వాడు పోయినట్టు వాడి బాడీ తీసుకెళ్ళడానికి అందరూ అరేంజ్మెంట్స్ చేస్తున్నట్టు వాడి కళ్ళు వస్తాయి. The loquacity may be accompanied with sleeplessness and yet inability to sleep. Ideas chase each other so rapidly through the mind that he cannot write them down. He sits up late at night, mental activity then being unusually increased. But this stage of excitement is commingled with another which soon entirely supersedes it. The mind is weakened. The patient is able to think only with difficulty. He has to stop to think how words are applied, like sulfur, lycopodium and medorna. There is vertigo worse on closing the eyes or on sitting or lying down. Vertigo with deathly painless syncope. In this vertigo, fainting, etc., you may compare the Ceridian, which has dizziness worse with the eyes closed, but as a distinctive feature, you will find that under the latter remedy, vertigo, pains and nausea are intensely aggravated by noise. Both remedies are useful in some stroke. Arsenic, hydrocyanic acid, digitalis, veratrum and camphor, you should compare with vertigo and fainting from cardiac weakness. Lorosis or hydrocyanic acid may be needed in long-lasting pain. There seems to be no reactive power. The face is pale and blue. The surface is cold. If fluids forced down the throat, they roll audibly into the stomach. If the syncope is attendant upon some poison in the system, as scarlet, the symptoms are similar, the eruption being livid and when pressed, regaining its color very slowly, like elan. Digitalis also rivals the ophidians in syncope. with the antecedent dim vision. The pulse is generally very slow, and the patient complains of nausea and deathly weakness in the epigastrium. Camphor and veratrum album display coldness and cold sweaty skin. In the latter remedy, the forehead is cold and sweaty. The face may be red while lying, but if raised it turns pale and the patient faints. The pulse is steady. Camphor has icy surface, sudden sinking as in lava cirrhosis. Although so cold, he throws off the clothing as soon as he is enough to move, even though he be still unconscious. Heaviness of the head on waking with nausea and dizziness as in some stroke. In the effects of the heat of the sun, compare Glonine, Belladonna, Natrum Carb and Ceridian. The first two with bloated red face, paralytic weakness, Glonine, unconsciousness, etc. resemble lechosis, but the latter displays the effects of heat upon one already exhausted. All the Ophidians are intolerant of warm, relaxing weather, and so we find many ailments returning in spring and summer. In the lechosis case, the patient may be an inebriate or one prostrated by mental fatigue. The sun's heat makes him languid, dizzy, faint, or if conditions ensue, the face is dark red and looks at the same time sunken and cadaverous. The extremities are cold. Here camphor may be demanded if vitality is ebbing away, the fainting spells growing worse, and the body icy cold and bathed in cold sweat. Cold sweat ఉండడం అనేది కరెక్ట్ లేదు. క్యాంఫర్కి డ్రైనెస్ కోల్డ్నెస్ ఉంటుందని స్వెట్ ఉంది. క్యాంఫర్ కి కార్బోహైడ్రేట్ కి చైనాకి వీటన్నిటికి డిఫరెన్స్ అదే. కోల్డ్నెస్ ఉండి ఐసీ కోల్డ్ గా ఉంటుంది, బాడీ అంతా డ్రైగా ఉంటుంది. కానీ కోల్డ్ బాగా చల్లటి గాలి కావాలంటే స్వెట్టింగ్ ఉండదు క్యాంఫర్. అదే స్వెట్టింగ్ ఉండి చాలా చల్లటి గాలి కావాలంటే కార్బోహైడ్రేట్. అదే స్వెట్టింగ్ ఉండి చాలా వీక్ గా ఉండి వీక్ పల్స్ ఉంటుందని చలి భరించినట్టు చైనా. Both lechosis and natrum carb are useful when hot weather fatigues, in which case you should compare also selenium and natramol. Returning now after this digression to the mental symptoms of lechosis, we find that the delirium is of low muttering type. At other times the patient seems to be going deeper and deeper into a torpid state with the coolness of the extremities and the trembling of the hands and the body. When asked to protrude the tongue, it comes out tremblingly or catches in the teeth and is usually coated dark brown, sometimes with little blisters on the tip. The lips crack and ooze dark blood. Loquacity is commonly followed by depression and by weakness, which amounts to a typhoid stage. Then comes delirium, but not of the violent belladonna type. These symptoms show lechosis to be an invaluable remedy in typhoid fever and in fact in all diseases of a typhoid state. The loquacity just referred to is particularly characteristic. Another mental state which these typhoid patients may have is the delusion that they are under some superhuman power. Diarrhea is usually present and the stools are horribly offensive, a strong characteristic of lechosis which will also aid you in diphtheria, scarlatina and other diseases of this type. Even when the stools are formed and in every way natural, they give forth this horrible odor. Lechosis may also be indicated late in the course of typhoid fever when the patient lies in a stupor with the dropping of the lower jaw and the other symptoms indicative of the impending paralysis of the brain. Let me now speak of some of the concordant remedies of lechosis in these conditions. In the loquacity just mentioned, lecasis should be compared with Stramonium, agaricus, nephritis, axilla erythematosa, and Paris quadrifolia. Stramonium you will distinguish from lecasis by the red face and other evidences of great sensorial excitement. Agaricus exhibits great loquacity associated with convulsing movements of the facial and cervical muscles, very incoherent talk. In nephritis, it is as if one were drunk. Under axilla erythematosa, the loquacity is usually associated with menstrual suppression, with puerperal mania, or as a part of delirium tremens, for which lecasis also is a useful remedy. Axilla cures wild imaginings of rats, etc., sleeplessness with wild crazed feeling about the head, incessant talking with continual change of subject. The patient must move about. Lecasis has more marked trembling of the hands, diarrhea, and greater exhaustion with the loquacity and hallucination. Paris quadrifolia causes a garrulity, which is much like that produced by tea, a sort of vivacity with a love of prattling. Tea ఎక్కువ తాగితే పైకి అలా ఉంటుంది, అంటే పైకి పోవాలంటుంది. In this typhoid state, the types of fever, you may compare lecasis with opium, hyoscyamus, arnica, lycopodium, lepis, muriatic acid, bacteria, and rootstock. Opium is indicated in typhoid fever with this threatening paralysis of the brain, but the symptoms under it refer to a very different condition from that of lecasis. The symptoms which indicate opium, in addition to this dropping of the lower jaw, are unconsciousness, stertorous breathing, and a dark brown red hue of the face. The darker red the face, the more is the opium indicated. With lecasis, the cerebral condition is due to the effect of the typhoid poison in the brain. With opium, it is a secondary effect from the intense congestion of the brain. Hyoscyamus is perhaps more like lecasis than is opium. Here we find the lower jaw dropped, the patient is weak and trembling, and there is a twitching of the muscles. This last is a necessary symptom of hyoscyamus. Here too, there is a strong breathing as in opium, with involuntary stool and great prostration. Arnica is also indicated when there is great congestion of the brain. The patient lies in a stupor with lower jaw dropped and eyes fixed, but even in stupor, as if the blood was too hot and hard. The face is dark red, the stool and urine are passed involuntarily. In addition to these symptoms, we find under arnica a symptom which differentiates it from the drugs just mentioned, namely dark spots here and there on the body, irregular in outline, and having a black and blue appearance, ecchymosis as they are called. Lycopodium is the complement of lecasis and is therefore more apt to be indicated after it than any other remedy I have mentioned. The symptoms which indicate lycopodium are these. The patient lies in a stupor with lower jaw dropped and rattling breathing. There is a rattling of phlegm in the throat during both inspiration and expiration, and the eyes are fixed in the chest and are filled with mucus. Lycopodium is the most important remedy we have in impending paralysis of the brain. But by that I mean to say that it is most frequently indicated. అదే ఇండికేట్ అవుతున్నారు మోస్ట్ ఫ్రీక్వెంట్లీ ఇండికేట్ చెప్తున్నారు. Lepis has not so markedly the dropping of the lower jaw, but resembles lecasis in muttering, delirium, trembling the tongue, etc. The bee poison, however, causes a nervous fidgetiness with sleepiness and inability to sleep, later muttering, delirium, happy, strange expression, abdomen swollen and extremely sensitive, hands and forearms cold, involuntary stool. The sensitiveness is a bruised feeling, differing from the hyperesthesia of lecasis. Muriatic acid displays a sunken face, tongue smooth as if deprived of capillary, or brown, shrunken and hard, sliding down in bed from muscular weakness. Baptisia has a dark, distorted face, drowsiness and stupor, goes to sleep while answering a question. Discharges from the bowels dark, fluid and very offensive. అలా మాట్లాడతాను మన రోజు చెప్పేది సార్ మన రోజు వెళ్ళిపోవడం అఫెన్సివ్ చూస్తూ బ్లడ్ చూస్తే ఏంటి అసలు నాకు టెంపరేచర్ ఉంది పల్స్ చూస్తే 82 మా ఫోన్ అందరూ పల్స్ చూస్తే 82 టెంపరేచర్ చూస్తే 104 చూస్తుంటే మా ఇది అన్నీ చెప్పింది అంతే మంచిగా సూపర్లోకి వెళ్ళిపోతాం మధ్య మధ్యలో కొంచెం బ్రీతింగ్ కూడా బ్యాట్లింగే కాదు సర్వస్ బ్రీతింగ్ వస్తాం అంటే ఇలాగా ఏదో తాగిన వాడు మొహల్లా ఉంది మక్కలు ఇదంతా కొంచెం విద్యులకు has a well-marked restlessness with relief from motion. Loquacity is not prominent. The tongue has a red triangular tip and the discharges are never so offensive as those of the former remedy. You must bear in mind that root cause is an erectistic remedy and must be very similar to existing symptoms if it is to be continued after torpidity testing without erectism. Leaving the mental symptoms of necrosis and the indications of it and its analogues in typhoid fever, we will next consider its head symptoms. We find that it produces a pulsating headache and usually in the left temple and over the eyes with mental confusion before the development of a coryza, relieved as soon as the coryza appears. That's it. The discharge establishment relief. This is a universal characteristic. As soon as the discharge is established, the patient feels better. I have relieved dysmenorrhea with necrosis when there was a headache preceding the dysmenorrhea, but relieved as soon as this flow was established. And the menopause there is burning in the breast. In catarrhal and rheumatic headache, you may compare mercurius, cinchona, pulsatilla, bryonia and gelsinia. Mercurius relieves the headache from suppressed coryza when there is a pulsating headache with pressure towards the mouth, worse when warm in bed and from damp windy weather. Cinchona when the pain is worse from the least drop of air. Bryonia and pulsatilla come into use when the checkered catarrhal secretion is thick and yellow and green respectively. Gelsinia when motility is lessened and the patient is drowsy, the neuralgic pains from the occiput to the forehead and head. Drowsy The headache may also arise from disordered stomach or bowels, or may be an accompaniment of fevers and of diseases of zymotic origin. The patient has an upward tendency of the blood with a throbbing in the head, dark redness of the face, puffed face, confusion of the mind, all the way from simple confusion to absolute stupor, often accompanied too by partial blindness, palpitation of the heart and fainting. The pains about the head are briefly as follows: sharp itching, which seems to concentrate at the root of the mouth. At other times, the pains go from the zygoma to the ear. This direction of the patient pains is characteristic. As a parallel of this shooting pain from the zygoma to the ear, we have pains from the head going down through and into the eyes. These are all characteristic pains of leprosy. There is an additional one that I will now mention. This is probably of a rheumatic origin. Pains in the head going down into the shoulders and the neck of the affected side, and often accompanied by slight stiffness of the neck, either sacral or rheumatic. You may have leprosy indicated in the severe forms of the head trouble. For instance, in inflammation of the membranes of the brain. You may have leprosy indicated in severer forms of the head trouble. For instance, inflammation of the membranes of the brain, sharp pains in the head, making the patient scream out, tongue showing slightly, strawberry tongue. Patient rolls the head from side to side and goes it into the pillow. Particularly useful in the leprosy. When an example like scarlatina or erysipelas has not developed or has been repercussed, the patient is at first very drowsy but unable to sleep. There is a trembling or palpitation of his heart, soon super anxious, and he becomes heavy and sleepy, and you can rouse him only with difficulty. In intense head pains, as in meningitis, you should remember the relation between belladonna and leprosy. The difference between these two drugs being rather one of degree. Both are suited to meningitis from erysipelas, to scarlatina, to apoplexy, etc. But the former represents the initial stages of these diseases, or the state in which even though there be stupor, there are still evidences of irritation and not only of depression. Thus, under belladonna, the patient often starts from his heavy sleep, cries out, grinds the teeth, awakes frightened, etc. The pulse is usually strong and the surface conditions are bright red, or it's more intense deep red and livid. If there is an eruption as in scarlet, now it is red, even if it starts, but the vitality is not so low that the extremities are cold or the rash is bluish and the cellular tissue infiltrated and threatening an unhealthy suppuration as in the snake poison. Often, however, after the use of belladonna, we find an evidence of cerebral exhaustion or blood poisoning or impending paralysis, in which case leprosy may be required. The patient still cries out in sleep or awakes frightened. The tongue still shows elevated papillae, the head is hot and the face is red, but the pulse is quicker and more feeble, the feet are cold, the surface heat is irregularly distributed, the mind is more befogged, and the drowsiness is easily creeping on. The inflamed part or the pseudomembrane or the eruption, as the case may be, is becoming more purplish. These indicate the change. Considering the action of leprosy on the special senses, we find the eyes to be affected by the drug. Dim vision, works on awakening, dark spots appear before the eye, sight suddenly seems to fade away, feeling of faintness and palpitation of the heart with these nervous trembling. Leprosy is one of the leading remedies for insight as an evidence of heart disease and vertigo. We may also use it with good effect for what we may term retinal apoplexy, where it acts very well in causing an absorption of the blood. Retinal apoplexy. The nearest remedies to leprosy in this condition of the retina are crotalus, phosphorus, arnica, belladonna and hemomethil. Copious ophthalmia calls for leprosy, where the symptoms are decidedly worse after sleep. There are great photophobia and pains of a burning, stitching, shooting character extending to the genitals, top of the head and occiput. There are also Itching and stinging in the eyes and the lips work from touch. Vision is misty with the black flickering before the eyes. Protalus may also be called for in keratitis when there are cutting pains around the eyes lead to swollen in morning. Ciliary neuralgia with deep cutting work during the night. In the diseases of the ear, lacusis may be remedial for roaring and singing in the ears and other sorts of tinnitus areas, which are relieved by putting the finger in the ear and working it. This shows that the illness is not congestive but of catarrhal origin, especially from occlusion of the stationary tube. The wax is altered in quality and becomes pasty and offensive. There is a swelling between the ear and the moxide process with a throbbing pain and stiffness. You can here compare nitric acid, capsicum, arum, pepper, and delicia. Elaps and protalus also have an action on the ears. Elaps like lacusis produces a catarrh with black cerumen, buzzing in the ears and atoria. In elaps the discharge is yellowish green, liquid and bloody. Only lacusis seems to have the eustachian stoppage, better from shaking the finger in the external meatus. Protalus causes a stuffed feeling in the ears, worse on the right side, associated with a feeling as if hot earwax was trickling out. The phase in the lacusis patient varies, of course, with the condition that obtains in the system at the time. In many of the diseases in which the remedy is indicated, the phase has an active pallor. In exantheric diseases, it is apt to be bloated or puffed and bluish red. If the eruption comes out, it appears sparsely and is of a dark color. Anxious and painful expression with the stupor, face disfigured, puffy, hot, red, swollen as after a debauch, blue circles around the eyes with abdominal troubles, as in ague. The face is earthy grey. Lacusis also has convulsions of the face, lockjaw, distortion of the face, stretching of the body backward, screaming, feet cold and itching, sudden swelling of the face. For swollen face, you may compare Apis belladonna, arsenic, lycopodium, hyoscyamus, rustax, pulsatilla, stramonium, candicarbon, phosphorus. For sickly, pale or earthy complexion, arsenic, bufo, lycopodium, carbonate, rustax, cinchona, phosphorus and phosphoric acid. Blueness around the eyes, arsenic, cuprum, phosphorus, sickle and veratrum album. Debauched look, bacteria, hyoscyamus, carbonate, naxomica, sulfur, opium and naxmotica. In facial conversions, compare naxomica, hyoscyamus, belladonna, hydrocyanic acid, lycopodium, cicuta, camphor, phytolacca and arsenic. Apis, arsenic and calicarb agree in puffing of the face even without any redness. In the first, there are also smarting of the eyelids and a sensation of stiffness. In the second, the swelling is noticed about the eyes, glabella and forehead, also lateral. Calicarb has the well-known sacs of the upper lids and also sudden swelling of the cheeks. The expression, complexion, etc. of arsenic are very similar to those of the snake poison. The anxiety and pain are marked by more restlessness, irritability, fear of death, etc. And the sunken face is more completely hypocritic with pointed features, sunken eyes and cold sweat. When yellow or earthy, it is cachectic. If trismic symptoms are present, the patient will be found lying pale and as if dead. Though at warm, suddenly he rouses and goes into severe convulsions, only again to relapse into this sort of cataleptic rigidity. The eyes are partly open with gum on the conjunctiva. Lycopodium has pale and yellow face, deeply furrowed, looking elongated. The convulsive movements are unique.
All through the provings of the remedy, you will note an alteration of contraction and expansion, and in the face you will note the tongue pushed out and withdrawn, spasmodic trembling of the facial muscles, angles of the mouth alternately drawn up and relaxed, arenae alternately expanded and contracted. The eyes may be partly open and covered with mucus, a bad symptom, generally being indicative of brain exhaustion. Lesser writings. But pair lesser writings again is lesser writings because the longer writings. The nearest remedies to lecasis. The nearest remedies to lecasis in this condition are the retina are protalus, phosphorus, arnica, belladonna and hemomel. Elaps and protalus also have an action on the ears. Elaps like lecasis produces a catarrh with black cerumen, buzzing in the ears and atoria. In elaps the discharge is yellowish green, liquid and bloody. Only lecasis seems to have the eustachian stoppage, better from shaking the finger in the external meatus. Protalus causes a stuffed feeling in the ears, worse on the right side, associated with a feeling as if hot earwax was trickling out. The phase in the lecasis patient varies, of course, with the condition that obtains in the system at the time. In many of the diseases in which the remedy is indicated, the phase has an active pallor. In exantheric diseases, it is apt to be bloated or puffed and bluish red. If the eruption comes out, it appears sparsely and is of a dark color. Anxious and painful expression with the stupor, face disfigured, puffy, hot, red, swollen as after a debauch, blue circles around the eyes with abdominal troubles as in orb. The face is earthy grey. Lecasis also has convulsions of the face, lockjaw, distortion of the face, stretching of the body backward, screaming, feet cold and itching, sudden swelling of the face. For swollen face, you may compare Apis, belladonna, arsenic, lycopodium, hyoscyamus, rustax, falciparum, stramonium, calicarbon, phosphorus. For sickly, pale or earthy complexion, arsenic, bufo, lycopodium, carbamide, rustax, cinchona, phosphorus and phosphoric acid. Blueness around the eyes, arsenic, cuprum, phosphorus, sickle and veratrum album. Debauched look, bacteria, hyoscyamus, carbamide, naxonica, sulfur, opium and naxmotica. In facial conversions, compare naxonica, hyoscyamus, belladonna, hydrocyanic acid, lycopodium, cicuta, camphor, phytolacca and arsenic. Apis, arsenic and calicarb agree in puffing of the face even without any redness. In the first, there are also smarting of the eyelids and the sensation of stiffness. In the second, the swelling is noticed about the eyes, glabella and forehead, also atramon. Calicarb has the well-known sacs of the upper lids and also sudden swelling of the cheeks. The expression, complexion, etc. of arsenic are very similar to those of the snake poison. The anxiety and pain are marked by more restlessness, irritability, fear of death, etc. And the sunken face is more completely hypocritic with pointed features, sunken eyes and cold sweat. When yellow or earthy, it is cachectic. If trismic symptoms are present, the patient will be found lying pale and as if dead. Though at warm. Suddenly he rouses and goes into severe convulsions. only again to relapse into this sort of cataleptic rigidity. The eyes are partly open with gum on the conjunctiva. Lycopodium has pale and yellow face, deeply furrowed, looking elongated. The convulsive movements are unique. All through the provings of the remedy, you will note an alteration of contraction and expansion, and in the face you will note the tongue pushed out and withdrawn, spasmodic trembling of the facial muscles, angles of the mouth alternately drawn up and relaxed, arenae alternately expanded and contracted. The eyes may be partly open and covered with mucus, a bad symptom, generally being indicative of brain exhaustion. Belladonna, you must now distinguish this erysipelas of lecasis from that of the remedies which are akin to it. Among these is belladonna. In its early symptoms, belladonna bears no resemblance to lecasis. But in the course of the disease, when the inflammation is so intense that the bloated face grows bluish red, threatening gangrene, or when the brain becomes affected, differentiation is necessary. Here both have not head and cold feet, hot head and cold feet, delirium, dry tongue, etc. But lecasis suits when the cerebral symptoms fail to yield to belladonna, and the excitement gives way to muttering stupor. The pulse is weak and rapid, and the cool surface of the limbs is plainly due to failing vitality rather than the upward tendency of the blood. Crocalus holds the same relation to belladonna. Apis mellifica is indicated in the erysipelas when the affected parts exhibit a tendency to become edematous. If the face is involved, the eyelids protrude like sacs of water. The face is usually a pinkish hue, or it may be dark purplish, but it never has the deep bluish black hue of lecasis. Although there may be a similar destructive tendency, the condition of nervous irritation produced by the bee poison is very different from that of any of its congeners. It is a fidgety nervous state, a fretted feeling which deprives the patient of sleep although he feels sleepy. Roostrax is suited to the vesicular form of erysipelas. The patient is drowsy as under lecasis. Little blisters form on and about the face, and the face is dingy red. Not the bluish black of lecasis, nor the purple of the intensified Apis case. If vesicles form in the lecasis case, they are quickly filled with pus. Speaking relatively, Roostrax produces more vesiculation and burning, stinging and itching, with more aching of the limbs and restlessness. Lecasis is more bluish red inflammation with gangrenous tendency. Euphorbium, since it causes gangrene with erysipelas, anxiety as from poison, apprehensiveness, dim vision, etc. deserves your notice. The right cheek is of a livid or dark red hue. Vesicles form as large as peas and are filled with a yellow liquid. The pains are boring, gnawing, and digging in character, and extend from the gum into the ear, with itching and crawling when the pains are relieved. Lecasis may be indicated in prosopagnosia when the pain is worse in the left side, and when there are tearing pains about the orbit and digging and screwing pains around the malar bone. Delirium appears as soon as the eyes are closed. The teeth decay and crumble The gums are swollen and bluish with throbbing pains. Lachesis may be successfully used in periodontitis and abscess of the root of a filled tooth. Compare mercurius, hepar, silicea, fluoric acid and petroleum. Of the allied remedies in toothache, none is so similar as mercurius, which like lachesis relieves when the gum is inflamed and the tooth decayed with abscess at the root. It is said to have a direct action on the dentine. The pains are tearing and pulsating and shoot into the face and ears. In lachesis, the gum is swollen and at the same time dark red and livid, or it is tense and hot and looks as if it would crack. Mercurius is markedly worse from the warmth of the bed. Lachesis often follows the latter. Or is needed at once if the patient has been previously salivated. Only mercurius has dirty gums with white edges. In sore mouth, aptha, etc., lachesis should be compared with bacteria, nitric acid, muriatic acid, arsenic and apis, while mercurius compares more with carbonate, staphylocria, calichlor, iodium, sulfuric acid and nitric acid. Bacteria has blood oozing from the gums, which look dark red or purple, salivation, fetor oris, offensive stools, and thus far is precisely like lachesis. Both two are indicated in the stomachache. Attending the last stages of cycle, decide by general differences and also by the tongue, which in the former is yellowish or brown down the center with red shining edges. In the latter it is red, dry and glistening, especially at the tip, and has its sides and the tip covered with blisters. Nitric acid causes an acrid saliva. The pains in the mouth are pricking in character, as from a splinter. The aptha and gums are usually whitish. There are raw places with shooting pains. Muriatic acid presents deep bluish ulcers with dark edges. The mucous membrane is denuded in places, the raw spots being dotted with aptha. Arsenic looks very much like lachesis with livid bleeding gums, edges of the tongue blistered or ulcerating area. The burning is more intense and is associated with restlessness, compelling motion in spite of the weakness. In gangrena oris, it causes more acute pain and heat in the mouth. Both have bluish or black fluffing ulcers. Arsenic has more mental irritability. Apis has blisters marking the bottom of the tongue or in clusters. The mouth is usually rosy red, swollen, and there are marked stinging pains. The margin of the tongue feels scalded, as does the mouth generally. Carbonate, staphylocria and sulfuric acid agree more with mercurius. The gums are white, spongy, ulcerated rather than livid. Staphylocria may cause sores, which look bluish red or yellow. Especially it is needed after the abuse of mercury, or in syphilitic cases where the general debility is marked with sunken face, blueness around the eyes, etc. Sulfuric acid produces great debility, yellowish white gums, yellow skin. The patient is nervous and hasty and constantly complains of trembling, which however is not observed by others. Salicylic acid causes the common chancre sores with burning, soreness and fetid breath. Lycopodium produces similar sores near the frenum of the tongue. Lachesis at the tip and nitric acid phytolacca, natron hypochlor on the inner side of the cheeks. Phytolacca has some systematic resemblance to lecasis here as well as in the throat. See next lecture. Both cause great weakness, dim vision, sunken face, blueness around the eyes, sore mouth, tongue blistered along the edges, tip of the tongue red, roof of the mouth sore, profuse saliva. The poke root may be distinguished by the great pain at the root of the tongue when swallowing. These pains are a part of the tired aching and soreness, which are general over the body. Helleborus produces a chancre in the mouth, but the sores are yellowish with a raised edge. Returning to the subject of decayed teeth, it may be noted that creosote cures pains extending from teeth to the left side of the face. Teeth decay rapidly, gums bleed, the blood being dark, but the accompanying facial pains are burning, and the patient is excitable, nervous, even as in children thrown into convulsions. Tuja causes a decay just at the border of the gums, leaving the crown apparently sound. Gums dark red in streaks, teeth turn yellow and crumble.